They'll say the spike in cases is due to a lot of people letting their guard down when it comes to the virus.
They say many might think that they're doing the right thing when they aren't. Fox 12's Audrey WEIL explains.
It's an interesting gap and a challenge we know health officials face, especially now 8 months into this pandemic. So for some insight tonight, we spoke with the chair of psychological sciences at University of Portland, as well as some folks just out and about.
We haven't seen our family in like a year.
It's been a long go already, and with COVID-19 cases now rising in Oregon, the Oregon Health Authority says following their guidelines is as important as ever.
We could probably do a little bit more by not going out at all, but that's a little bit hard.
The governor and OHA saying you're most likely to get COVID-19 from family and friends. That small indoor informal gatherings are driving the spread. And Oregonians are letting their guard down and need to be more strict with themselves. I asked Dr. Dina Jolka, the chair of psychological sciences at University of Portland, if we know to follow the guidelines, or maybe even think we're doing our best, why is it that we're apparently not doing well enough?
I think people, they're getting a little tired of the changes and feeling like there's no end in sight, so willing to make concessions that, well, maybe if I just have this number of people, but there's definitely a loosening in terms of behaviors.
And Dr. Jolka says it's not human nature to stay separated and avoid physical touch. Plus, people may have been in the mindset of having to make these sacrifices for 2 or 3 months, not 8 months with no end in sight. And yes, COVID fatigue is a real thing.
With anything that breeds uncertainty and fear, we do get tired of. We can't maintain that level for all time. It's too wearing on the body in a mental, emotional, as well as physical sense.
But health officials say we have to stay vigilant to save lives, not go to any parties, wear face coverings outside the house, and keep distance. I asked Dr. Jolka if there are some things we can do to keep ourselves sane while also following these public health guidelines. And she did have some suggestions. She says physical activity, yoga, meditation are all good things. She says even talking about anxiety, uncertainty, or loneliness can help. And she says while we're not seeing as many people, maybe focus on deepening connections with the people you do see. Reporting in Northwest Portland, AUDREY WEIL, Fox 12 Oregon.